So what kind of pushback have you had on moving forward with these plans? I mean, is there any retaliation with insurance companies and on the state level and insurance commission and all that? Because I'm curious.
Janet, you don't know me very well, but when I speak, I'm like E.F. Hutton. People listen. There's no pushback. Just do whatever I tell them to do. What's your next question? No, look at Janet. She's going, who in the heck is it?
I just watched Yellowstone, yeah.
No. Just quickly, I will tell you that the CEO of Cigna jumped in an airplane and flew down to meet with that school district when they were fixing to get fired. So anyone that wants to ever question me on the cartel, it's probably not worth your time, because I think I win. But they stayed the course. And they did what they did. I think Cigna still sued the school district. That's out there. You can Google it. Crazy stuff, Janet. So, but they stood the ground and it's worked. And these plans produce better clinical outcomes for the members,
of course,
and better financial outcomes for the members and the employers. And so, that's probably, and again, they stayed their course, but the pushback we get is from employers that we're talking to. And now we have so many stories. I mean, if you go to our website on the news sections, there's like 80 things. I mean, we've been blessed. We've been in Forbes, a lot of places, but even then you can get pushback. And we're pretty much to the point where if we met with you guys and y'all started questioning, I said, hey guys, that's okay. We're good. We're going to be here 20 years from now. I hope you are, but we're going to still be here. And, maybe you'll, realize what we're talking about then, but we got to move on because there are a lot of people that need our help. I mean, in so many words, not quite that way. I had a little Southern flair to it and it's a little softer, but that's what, that's the truth. I mean, you haven't got time to mess with people that don't get it. And not everyone's going to want to do this, and that's okay.
Well, Jan, I can definitely agree to that with our business model.
It's a crawl, walk, run, fly, as we like to say. It's a journey. Crawl, walk, run, fly, and you have to meet the employer where they are. I'd like the employer to jump in the deep end with cinder blocks on, but that's not where everybody is.
Yeah.
If you educate them right, most of the time, my personal experience with my clients and the joint work I've done with other mitigate partners, they've jumped in the deep end with cinder blocks, because if you educate them, there's 6 real deficiencies of legacy healthcare insurance programs, and I'll call them out real quick. If you want to go into detail, we can, but I'll keep it simple. Embedded conflicts of interest, i.e. the cartel. Number 2 is a lack of pricing and quality transparency. Yeah. Number 3 is the fraud, waste, and abuse, medical billing errors. Number 4 is the traditional PPO discount game. Number 5 is the pharmaceutical shell game, which I know y'all are familiar with. And then number 6 is lack of information and data. And it was kind of a negative message. So we have basically said, if you eliminate these deficiencies, you can turn them into the 6 opportunities in healthcare for you. And that's really what Fair Cost Health Plan was built around, solving for those 6 deficiencies.
Well, I think you hit on something we discuss often, and that's transparency. And, in the traditional model with insurance coverage, traditional insurance, there is a cartel. Hospitals and insurance companies have colluded to create a cartel. Okay. And one of the things they do is they keep pricing non-transparent. So, well, how much does that cost? Well, we don't know, or it depends, or it's complicated. Crazy answers that we would never accept in any other industry. Yet, it's not that complicated. It's really not. And transparent pricing, that the consumer needs to know what prices are being charged for their services. And that actually increases service and it increases quality. Now, the hospitals and the insurance plans, they would like to tell you different, but that's absolutely not the case.
Yes, sir. You're not getting the arguments from this side.
Well, so tell us about, do you think sometimes there's skepticism? Like if you go to an employer and you tell them you can save them 50% on their insurance costs, but it has nothing to do with United or Premier Blue Cross, what have you, do you think they're skeptical? Is that one of the pushbacks that you get?
Yeah, there's no question about it. I mean, I think my good buddy David Contorno always talked about Stockholm syndrome. Where you
Right.
fall in love with your captor, and I think you have that. I think we're working with a pretty large political organization. That's all I'll say, out of Texas right now, and they made a comment. We really like having that blue cross on the ID card. It feels like a warm blanket. And we said, well, it's like a warm blanket with smallpox all over it.
Right.
But,
Yeah.
but that's the deal. So I will tell you the biggest hurdle. And Shawn and Janet, we want to be clear with everybody. I mean, we make no bones about it. It is not easy, and we want them to know it will be bumpy. It is not going to be an easy deal. It's going to be 3 to 6 months of some growing pains, some teaching, some learning, and that's just how it is. But the key question you ask any of the employers that went and followed this fair cost model is none of them would ever change back and wish they had done it a lot sooner. But it is difficult at first, and I think when you look at these employers, you have to, the things that we really want to address is, because here's what's goofy. You talk about these BUCA plans. I mean, I'd tell you, when we were in Dallas up here on stage, I said this: how many of y'all, I would love you to put my Fair Cost logo on all y'all's ID cards. I would love that free advertising. Y'all have given these BUCAs free advertising for years on the ID cards. And the funny thing is, it's your plan. It's the
True.
more I'm going to mess y'all's name up. The more pharmacy plan. So why isn't your name on the card? I don't understand. And we've often said that the only payers in healthcare are employers and employees.
All right.
The insurance company doesn't pay anything. They're using your money and the employees' money. They're the processors is what they are. They process the money. They don't pay a dead gum thing. So you guys, and we'll have to have a one-on-one lesson with y'all when we're done. All of y'all call them the payers. Don't give them that credit. They're not the payers. Medicare, who's the payer of Medicare? You and me.
That's right.
I mean, there's no payer. They're processors, and the processor, the payer should be on the card, and that's the employer. That's whose name ought to be on the ID card. So when you go out there and use our cards, they'll have a fair cost, and the employer, of course, nobody knows who fair cost is, but as the employer, we don't take this insurance. What do you mean? I work for this company. And they call the number on the back, verify eligibility, and you're generally pretty good, but you'll get pushback because it doesn't have that blue. Yeah. It doesn't have blue or a United on the card. I mean, it's unbelievable. And healthcare isn't broken. It was made this way. These folks were brilliant. I wish I was as smart as they were.
Well, you said it. It's like, they're getting paid millions to process these claims. They're not really paying for anything. Your monthly premium, that's $1,500 a month. That's what's paying it.
It's a cost plus service. That's what no one seems to figure out.
And that's why they don't care what the cost is. That's why healthcare costs have become so expensive. And when we put transparency back into pricing, healthcare costs come down. I mean, look at when people price shop for healthcare services. If people price shop for healthcare services, prices plummet.